Hello, my name is Erin Lee, and I'm a coordinator of pre-pharmacy programming. It is my honor to introduce our second keynote speaker, Dr. Kathleen Hill-Besinque. Dr. Hill-Besinque is an associate professor of clinical pharmacy at the USC School of Pharmacy. She is currently the assistant dean of curriculum and the director of experiential programs. In addition to teaching at the School of Pharmacy, she also teaches for the academic medicine program at USC's Keck School of Medicine. Her clinical practice area is women's health across the life cycle, including emergency contraception and menopause therapies. She is actively involved with several professional national organizations, including the American College of Clinical Pharmacy, the American Society of Health System Pharmacists, and the American Association of Colleges of Pharmacy. She currently serves on the board of directors for the Association of Reproductive Health Professionals. She is also the president-elect for the California Pharmacists Association, and lastly, she is treasurer for the Southern California Society of Health System Pharmacists. Please join me in welcoming Dr. Kathleen Hill-Besinque.
So thank you for that nice introduction. It's really a pleasure to be here today and see so many people excited, I hope. Can I see some? Yeah, excited and interested in the profession of pharmacy. I don't know if you could have come upon pharmacy at a more exciting and perhaps a little bit terrifying time because there's so much change that's happening in the practice of pharmacy. As Dr. Main had alluded to in her talk, pharmacy is going to change more in the next couple of decades than it has changed in the last 100 years. And as she said that, I found myself reflecting a little bit about what pharmacy was like when I sat in your chair. And I'm going to share that with you for just a brief minute. When I sat in the chairs that you're in and was thinking about pharmacy, most pharmacy degrees and most colleges offered baccalaureate degrees only. The Doctor of Pharmacy degree was kind of a rare thing. It was one of those California things, and I'm proud to be a Californian. We're always doing things our own way. The opportunities for a pharmacist were far more limited. Most pharmacists either practiced in a community pharmacy or in a hospital. There were a few out there doing long-term care, a small number in academics, and maybe a few of my classmates actually went into industry, selling medications as representatives. If I look at pharmacy today, I see an entirely different profession. I see a profession where the entry-level degree is a Doctor of Pharmacy degree. That's the national standard. It's the only entry-level degree for pharmacy. I see a profession where so much has changed, where the opportunities to work in a hospital or to work in the community are still there, but so many new opportunities have opened up. There are entire areas of practice that were unknown when I went to school. You can practice as a primary care provider in a clinic where patients come to see you just like they come to see other primary health care providers. You adjust their medications, you order their laboratory tests, you examine them. That was really unheard of when I was sitting in your chair. You can work for a large pharmacy organization, either an insurance company, an HMO like Kaiser, or within the Veterans Administration, not in the pharmacy, but actually managing the healthcare system in those organizations. You might evaluate the treatment of hypertension. You might sit at the table with the physicians and say, how are we going to make hypertension management work for our patients? How are we going to get our patients with diabetes or hyperlipidemia, which is too much cholesterol to simplify it? How are we going to make sure our patients live better and longer lives, and what are we going to do with medications to help keep those diseases in check? There are so many opportunities out there for you in pharmacy, many, many more than when I was sitting in your chair. I think that makes this a very exciting time, but it also makes it a little bit scary because there's so much out there, so many things that you can do. Now you're going to have to choose. One of the things I was asked to talk about in my presentation today is Senate Bill 493. How many of you have heard of Senate Bill 493? Oh, good, a few of you. I'm happy to say that to celebrate National Pharmacy Month, that's how I look at it, our governor, Governor Brown, signed that bill into law on October 1st. And what that means for those of you entering the field of pharmacy is pretty profound. The most uncontroversial part of the bill was that the legislature firmly stated that the pharmacist is a healthcare provider. Everybody knew that, but it wasn't actually written down front and center in our Pharmacy Practice Act, and now it is. But that's not the big news. The big news is the bill did several things, and I'll kind of go through them one at a time to give you an idea of how profound these changes are, and maybe on your career as a pharmacist. They're going to impact education, they're going to impact postgraduate training, and most of all, and best of all, they're going to impact the health care of the citizens of California, and as things go, perhaps the rest of the country, as pharmacists really take hold of our role and our responsibility for drug therapy management in our patients. So the second thing the bill did was it said that a pharmacist who's monitoring, watching over a patient's drug therapy can order laboratory tests. Now, hospital pharmacists have been able to do that for a long time, but your community pharmacist has not been able to write up a lab slip and say, my patient needs the hemoglobin A1C checked because they have diabetes and I need to know what their blood sugar is doing. Now, pharmacists can do that in the outpatient setting starting January 1st. In order to do that, pharmacists will need to have more direct communication with the other members of the healthcare team. You don't want to be out there in a pharmacy ordering laboratory tests that never get back to the chart, so no one else knows about it. You're going to have to talk. You're going to have to talk to the physicians, to the nurse practitioners, to the PAs, to the patients, to their families, to everyone involved in their care. And that's a pretty great change. It makes it much easier for a pharmacist to assist in managing drug therapy. The next thing the bill did was it identified some conditions that you don't need a diagnosis for. One of the pillars of pharmacy practice is really our knowledge of drug therapy and therapeutic management. Diagnosis is really the purview of the physician. It's not something you're going to get a lot of training in. Certainly you'll understand how a diagnosis is made. You'll understand the criteria, but we don't diagnose patients right now in pharmacy, but we sure do treat them. And the legislature recognized that conditions that don't require a diagnosis, but do require drug therapy, are perfect opportunities for the pharmacist. As Lucinda indicated, there are 5 million Californians who are going to have access to health care on January 1st, thanks to the new Affordable Care Act. Who's going to take care of them? Pharmacists are going to be a help in that process, and these conditions are going to be great. The first one, the one that's near and dear to me, is that pharmacists will be able to provide self-administered hormonal contraceptives to women who come into the pharmacy in need. You don't need to go to a doctor to find out whether or not you want to get pregnant. That's a decision. There's nothing about providing hormonal contraceptives that's needed that a pharmacist can't do. All you need to do is take someone's blood pressure, have them step on a scale, and ask if they want to get pregnant. And if they don't, hormonal contraceptives can be provided by the pharmacist. It's a wonderful change, and it's about time. Another self-diagnosed condition that's going to impact pharmacists is smoking cessation. Smoking is one of the largest preventable killers of patients in this country. And starting next year, pharmacists are going to be able to provide to patients all nicotine replacement products for the management of smoking cessation, including prescription ones. This is going to help improve our public health situation. It's going to provide pharmacists with the need to acquire skills that maybe they haven't had before. They're going to have to work with patients one-to-one. Another area that this bill addressed was travel. If you booked a ticket to go to India or South America or some other place, you don't need a diagnosis for that. You know you're going there. You bought the ticket. So starting next year in California, pharmacists will be able to provide to patients going abroad the medications recommended by the CDC, including prescription medications. So anti-malarials, as an example, would be something you could get from the pharmacist. You don't have to go to a travel clinic. Along the same line, pharmacists are going to have their ability to provide immunizations expanded. In the past, one of the barriers to broader uptake of immunizations in pharmacies has been having to establish one-to-one relationships with physicians to immunize their patients. Well, the legislature recognized that pharmacists have been doing a fabulous job with flu vaccine, and why not expand that? When the bill was up for discussion, one of the colleagues I have from working on the Pharmacy Access Partnership was the state director, well, actually it doesn't matter who, but anyway, someone called me up and said, how should our office look at this bill? Should we support it? And I said, yes, you should, because that will allow pharmacists to be able to provide Gardasil, for example, in pharmacies throughout California to both men and women. And they said, okay, that's great. We need more immunizers out there. We need to make it easy to prevent disease. And so pharmacists will be able to provide these immunizations to all people over age 3. So we're leaving the pediatric vaccines to the pediatricians. Those 4 changes are big. They're going to impact your practice, no matter where you decide to practice. If you become a pharmacist, you're going to need to acquire those skills. Now, we already do that in our education program, so I'm going to touch on that in a minute, about why it's so big if we already teach that. The last thing in the bill, which I think is the most exciting and potentially the most far-reaching, is that it creates a new category for pharmacists in the state of California. Currently, there are 2 other states, New Mexico and North Carolina, where pharmacists have a separate licensure category to be an advanced practice clinician. And in California, we will have that category beginning next year. And what that means is, if you are designated as an advanced practice clinician, you can initiate drug therapy, you can discontinue drugs, you can order, in addition to laboratory tests, imaging studies like a DEXA scan if you're monitoring someone who's got osteoporosis. So it's going to be a fairly broad addition to the scope of practice. Now, the advanced practice clinician is going to require postgraduate training. In order to qualify as an advanced practice clinician, a pharmacist is going to need to have completed a residency program, needed to practice for 1 year under collaborative drug therapy protocols, or have board specialization. A lot of the details of qualification for this are still being worked out, and that would be part of the regulatory function of the Board of Pharmacy. But that's really big. It's going to change pharmacy in a very important way. So how's it going to affect education? Well, I said that you already know how to do all these things once you finish pharmacy school. We do teach them to you. But it's a little bit of use it or lose it. Sometimes when you learn things in class, and I'm sure you can come up with a few examples, you think, why am I learning this? I might not need this later. That equation's going to change pretty significantly for a lot of areas in our curriculum. You are going to need to keep it. You are going to need to use it because it's going to be part of practice in a very permanent way. We're going to have to increase the emphasis in our curriculum on working with patients, on developing team-based skills, making sure that you know how to present your patient's needs to the other members of the healthcare team in a way that's going to be getting the action you need. If you need something brought to the attention of another member of the healthcare team, you need to know how to get their attention in a good way to get their attention. You're also going to need skills to help you work with patients effectively. In the past, you could simply say, take one 3 times a day, take it with food, come back at the end of the month and get more. And that was what you were accountable for. Now, as a pharmacist, you're going to be accountable for whether or not the patient actually takes it, whether or not they actually get better. You're going to need to say, Mrs. Jones, Mrs. Smith, here's your medication. Let's talk about how this medication is going to help treat your condition. How can you take it? What do I need to do to make it easier for you? And what questions and what concerns do you have about this medication? It changes things a little bit, but it changes them big. To become an advanced practice clinician, you need to do a residency. There are alternate pathways that will be made available, but a residency is going to really be important. How many of you are familiar with pharmacy residencies? So there's people in the front row. They must have come to a presentation before. When I entered practice, there were 150 residencies in the entire country. Today, there are almost 3,000. But there are how many? 13,500 students that graduate every year from schools of pharmacy. And you don't really need a calculator to figure out that that means there aren't enough residencies out there for everybody. So we're going to need to develop more postgraduate training. And those of you sitting in these chairs are going to need to be thinking about postgraduate training in your career plan and factoring that into your equation. Postgraduate training and residency programs are very important in acquiring the skills that you need to provide the advanced level of care. If you want to be the oncology pharmacist or the critical care pharmacist or the smoking cessation diabetes pharmacist, you're going to need a residency or you're going to need some additional experience beyond what we can give you in a school of pharmacy. So there's a lot of change going on. One of the bullet points on Lucinda's slide touched on advocacy. How many of you are involved in advocacy programs now? Fewer hands going up. Well, you may or may not realize it, but licensure and practice are very strongly influenced by the legislative process and by the public and public demand. And I would encourage you as students to get involved, to become an advocate for your profession, for yourself as a student, for your community, and for the things that you believe strongly in, because that's how things change. Nobody woke up one day and decided, oh, let's change the Pharmacy Practice Act. That seems like a good thing to do. It didn't happen out of the blue. It happened because of the hard work of a lot of individuals. And the last piece of this that I want to touch on brings back Dr. Main's point about interprofessional collaboration. Who do you think sponsored the bill to change the scope of practice for pharmacists? Anybody know? You think it might have been, oh, you know, well, who was it? Senator Hernandez. Is he a pharmacist? No, he's not. He's an optometrist. And part of the beauty of 493 is that it's really part of a collection of bills. It's interprofessional. It's all of us working together, not in silos. And interprofessional collaboration, interprofessional patient care, interprofessional education is really the way to go. Now, you're in here because you're interested in pharmacy. But keep your relationships open with your colleagues that you're in classes with now that are going to go into medicine or nursing or physical therapy or social work or even law, because we need the lawyers too. Sometimes I get funny looks when I say law is really important in patient care, but it is. It comes back all the time. So stay connected with your colleagues that are not going into pharmacy school with you, because you'll need those connections and you'll need to keep those relationships strong. And that goes both ways. It's good for pharmacy and it's also good for those other professions. It's important that they know what you know. Yes? Right? Okay, sorry. Thought you had a question, but it was just 5 minutes. So I want to sort of bring things back to where we started. And that is that pharmacy is entering very exciting times. There's a lot of change. Some of that change is long overdue. And some of that change, quite frankly, is a little bit scary. It was a lot more comfortable to be able to say, take 2 and call me in the morning if you have a question when you were a pharmacist. Don't take it with food. That was a lot easier than it's going to be to say, would you like me to help you quit smoking? How can we bring your diabetes under control? Those are big changes. It changes the relationship. It changes the level of responsibility and accountability. And it makes it far more important than it ever was before that the healthcare system function as a team, where all of the individuals on that team know each other and what each other can do and is best suited to doing. You can't imagine, I don't think, if you play baseball or football, if the quarterback just showed up on the field and never met any of the other players and then had to figure out who he was going to throw or pass the ball to. It wouldn't work very well. If I were the quarterback in that circumstance, you know what I would do? I would run the ball every time myself, because at least I would get the ball somewhere and I would know how to do it. And that's what's wrong with our healthcare system right now. It's the quarterback just runs the ball because he doesn't know or she doesn't know who to pass it to, who to hand it off to, and what the other people on the team are capable of. So think about that. I hope I've given you some things to think about. I hope that you are successful and continue your interest in the profession of pharmacy, because although things are changing, I think they're changing in a wonderful way, and you're going to be able to be a part of it if you join up with us and move into pharmacy practice. So thank you and good luck.